Hello and welcome to another session of Dr. Barbara Miller's NCLEX review. Today we're going to be talking about the difference between acute kidney injuries and chronic kidney injuries. So please like, share, and subscribe to the channel to help it grow. So let's start with the difference between acute kidney injury, AKI, is a sudden loss of kidney function. It's usually reversible. Okay, what's the pathophysiology of acute kidney injury? You do have three underlying causes: pre-renal, where the blood flow to the kidneys reduced, okay, or lowered due to shock. It could be sepsis. It could be hypovolemia, renal vascular obstruction, and the second, intrarenal. Okay, it could be a direct damage to the kidneys. For example, someone sustained physical trauma, hypoxic injury, chemical injury due to toxin or medications. And post-renal, it could be mechanical obstruction to urine outflow. For example, the patient may have a tumor, okay? A patient may have stones or BPH, benign prostatic hypertrophy, which causes the urine to back up into the kidneys and cause impaired function of the kidney. So, what are the phases of acute kidney injury? The onset, it begins with the precipitating event. Oliguric urine output is less than 400 milliliters per day, which lasts roughly about 10 to 14 days. The diuretics phase, urine output is 4 to 5 liters per day and will go on 1 to 3 weeks. And the recovery phase, it takes up to a year or 12 months. What are some clinical manifestations of acute kidney injury? For the oliguric stage, patient will have hypervolemia. Okay, they will have clinical manifestations such as edema, high blood pressure, hypertension, pulmonary edema. They will also have dysrhythmias due to hyperkalemia. Remember, hyperkalemia causes a peak, a tall T wave. Okay? They also will have Kussmaul's respiration due to metabolic acidosis. They will experience nausea, vomiting, seizures, and coma. And the diuretic phase, polyuria, excessive urine, hypovolemia. For example, they become very dehydrated. They will have a drop in the blood pressure, hypotension, and they will start having tachycardia. The labs that you should look for, you're going to see an increase in the creatinine. Remember, the normal creatinine roughly is about 0.6 to 1.3, and your normal blood urea nitrogen is about 10 to 20. So you will see an increase in both creatinine and the blood urea nitrogen. You will have a fall in the glomerular filtration rate. Their hemoglobin and the hematocrit going to be reduced also. they will have a buildup of potassium, hyperkalemia, hyperphosphatemia, and hypocalcemia, hyponatremia, and metabolic acidosis. So how do you diagnose acute kidney injury? They're going to do a non-contrast CAT scan, renal ultrasonography, and a kidney biopsy. How do you treat that? Okay, you're going to treat treat the underlying cause. Okay, if it's a medication it's causing, you want to discontinue that. So medications, you want to give diuretics, you want a medication to decrease the potassium levels. For example, sodium polystyrene sulfonate, insulin, and dextrose. Calcium glutamate, cardiac protection from hyperkalemia. And they also will do dialysis. So the nursing care is for the nurse to monitor the patient's intake and output. Daily weight is paramount. You want to restrict fluid as ordered during the oliguric stage or phase, and decrease potassium, sodium, phosphorus intake. And in contrast, chronic kidney injuries, they are irreversible. Once the kidney starts failing, it does not stop when it gets to the chronic phase. The pathophysiology is chronic and sustained nephropathy leads to kidney fibrosis and destruction, which includes the glomerulus, tubules, and the interstitium. Okay, what are the risk factors as we go through the aging process? Older age, dehydration, someone who has a history of acute kidney injuries, diabetes, hypertension, chronic glomerulonephritis, nephrotoxic medications, or autoimmune disease such as systemic lupus. What are the signs and symptoms of chronic kidney disease? Fluid volume overload, example, jugular vein distension, hypertension, dyspnea. Patient will have difficulty breathing because of the accumulation of fluid in the interstitial space. Tachycardia, crackles, peripheral edema. Patient will become lethargic, have tremors, become nauseated, vomits. They have itchy skin, pruritus, uremic frost. For example, crystallized urea deposit on the skin. So the laboratory and the diagnosis that nurses must know with chronic renal disease, the blood will show a decrease in the glomerular filtration rate. The creatinine and the blood urine nitrogen, potassium, phosphorus, magnesium will increase, and they will have a decrease in sodium, calcium, the hemoglobin, and the hematocrit. Urine will have hematuria and proteinuria. So remember the stages. You got to know the stages for chronic renal disease or chronic kidney disease. it goes through 5 stages. So the first stage, the GFR is going to be less than 90 milliliters per minute. Normal kidney function, persistent proteinuria. Stage 2, the GFR is going to be between 60 to 89 milliliters per minute. Mild kidney damage, persistent proteinuria. Stage 3, the GFR will be between 30 and 59 milliliters per minute. Okay, moderate kidney damage. Stage 4, the GFR is between 15 and 29. It's severe kidney damage. And stage 5, the GFR is now less than 15 milliliters per minute, kidney failure. So what are some medications that they will give to these patients, such as diuretics, sodium polycistrine, sulfonate to decrease serum potassium. To decrease the heparin alpha to increase the red blood cells. Phosphorus binding agent, antihypertensive, vitamin, mineral, and supplement. Procedure, they must be on dialysis or go on the transplantation list. Nursing care, monitor intake and output. Daily weight, you want to restrict fluids, sodium, potassium, phosphorus, magnesium intake as ordered. Thank you for watching. Hope this review on the different types of kidney or renal failure be beneficial to your preparation. Please like, share, and subscribe.